So now we will go to screening for chlamydia and gonorrhea. So what are the recommendations? The opportunist screening for chlamydia and gonorrhea at primary care visits using a self or clinician collected sample. uh, Conditional recommendation, very low certainty. So there is like they are giving the kit to the patient so she can do the self, or the it can be done at the office also. So that is the main recommendation. So who should be this recommendation apply to? So it applies to all sexually active individuals under 30 years of age. Sexual activity is defined as even having oral, vaginal, or anal intercourse. So any kind of sexual activity. Most cases occurs in Canadians under age 30 with increasing rates between 15 to 29 years. So this is the highest age group in which this infection is present. So that's why they are screening under 30 years. Evidence of benefit of screening. This extends the eligible screening population from previous Canadian guidance to reflect increasing rates like 25 to 29 years. It was, I think, before, but now they have seen it is 15 to 29 years is the um, most effective age group. Now, who does this recommendation does not apply to? It does not provide guidance for pregnant patients, individuals known to belong to high risk group, or patients specifically seeking care for a possible STI. So if they have already have it, or they are like getting treatment or high risks. So these are not included in the screening. Pregnant patients and those who are screening testing or who are known to belong to a high risk group should be managed following applicable national, provincial, or local guidance. So there is like separate guidance for their treatment right away. And then high risk includes having multiple sexual partners, previous STI, or having sex without a condom. So the same thing, this high risk is important because they can always give one or two high risk things. So these are not included in the regular screening populations. So why we are
Normally, when they give high risk, then we do the screening. In this case, if they give the high risk, then we will not do the screening. Yeah.
no, so in this case,
Mhm.
the screening is done for everyone who
Yeah.
is under 30 years and she is sexually active. So
Mhm.
whether she is like, high risk or low risk, even if she is sexually active, just only with one person or like no other high risk, we are screening them because this population is like having so much like STIs present, right?
Yeah.
But if the patient is coming and she is like having multiple sexual partners, or she is already having previous STIs or like those high risk behaviors, then she doesn't come to this regular screening population, right? So then we have to treat them as high risk right away.
Oh, thank you.
Yeah. So why we are recommending the screening? So chlamydia and gonorrhea are the most commonly reported bacterial sexually transmitted infections in Canada. 1 in 20 sexually active individual 15 to 29 years will get chlamydia. So this is basically very high rate, and chlamydia is the most common one. So that's why they are doing the screening. This recommendation supports an uncertain but potentially important benefit of reducing pelvic inflammatory disease. Screening of males may help prevent negative health consequences in females. Patients under 30 general prioritize the benefits and harm and all this. And then individuals at high risk of infection may not always readily self-identify or easily identified by clinicians. So this routine offer to screen may reduce the barriers to screening and improve the health equity by normalizing screening. We have included both chlamydia and gonorrhea in this recommendation since they are tested together. So if a young female is coming to your clinic and they ask in the CDM or whatever, like what are the recommendations or counseling or what you want to screen. So this is one of the screening tests they are looking for because they are doing it to all the sexually active individuals under 30 years. So it is chlamydia and gonorrhea. So I mean they have different screening, but we will do like the important ones and then go ahead. So the lung
And we
cancer.
have to inform for both these tests to the ministry, health ministry, for gonorrhea and chlamydia, both, if
Mhm.
they are positive.
Okay, so reportable. Yeah.
Yeah, reportable disease.
Okay, thank you. So now the lung cancer screening we have studied in Toronto Notes. So we recommend screening lung low dose CT in adults who are 55 to 74, who are current smokers or former smokers who have quit within the last 15 years. So more than 15 years not included in the screening. Have smoked one pack a day for at least 30 years or two packs a day 15 years or equivalent 30 pack years. So I think we discussed what is pack year. So everyone is good with the pack year so far.
But we just read it in Toronto Notes, right? The screening for lung cancer.
Yeah.
So this is another book.
This is not the book. This is the Canadian Task Force website
Oh, I see.
that
Okay.
do all the recommendation for screening in Canada. So we are just like quickly going through.
Doctor, this
Green.
means that the Toronto
Okay.
notes is not enough. We have to do from the Canadian Task Force.
So
Task
if you
Force.
see, it is basically the same thing. It is just like they have written some high risk or, just for the information, but like the basic thing is the
Yeah.
same. So we can do
Okay.
any of one.
Okay.
So,
Thanks.
yeah, so we do not recommend the screening with the chest X-ray. So this was also written there. So what is low dose CT and why should I screen with it? Low dose CT is a very detailed scan of your lung and it can pick up much more than a chest X-ray. And so that's why they are doing the low dose. And why should I not be screened with chest X-ray? Because no demonstrated benefit of screening with the chest X-ray. And why should I be screened once a year for 3 years? Currently, we have evidence for only on the benefits and harms of annual screening of 3 years in a row. So once a year for 3 years. And if I test positive, what happened? Most people who receive a positive low dose CT results do not really have lung cancer. These are called false positive. So this is important. Like even if the low dose CT is positive, it is not 100% right test. It can have like the false positive also. So if you receive a positive scan result, you may go through additional testing to confirm whether you have or not, because this
Which
is.
we will go through which test to confirm it.
So they wrote here some of those follow-up tests can be invasive and there is risk of major complications and then possibly death. So they didn't write all the tests, but this is just the screening test. So if it is positive, then they are maybe do the like biopsy or like do other tests. So this is, I think, the same thing. Yeah, so this is just the same thing. So basically that is for the screening, I think.